So what is prenatal care? So prenatal care is a supervision given to a pregnant woman throughout the period of pregnancy. So the purpose of prenatal care is to assess the woman's general physical conditions that may affect her health and the baby throughout the pregnancy, to give health instructions and supervisions in carrying out prophylactic and therapeutic measures, and to prepare the woman holistically for pregnancy, labor, delivery, and infant care. So the data to be collected in initial interview is the past history, the past illnesses or diseases like kidney disease, heart disease, hypertension, diabetes, thyroid disease, sexually transmitted disease, unira, urinary tract infections, tuberculosis, asthma, and gallbladder disease. So for childhood diseases such as measles, poliomyelitis, and chickenpox, the past-surgical procedures, and the lifestyle such as alcoholism and smoking, and also the self-medication or oral the counter drugs and use of illegal drugs. So the presumptive sign of pregnancy is amenorrhea, breast, breast tenderness, nausea or and vomiting, fatigue, darkening of pigmentations on face, breast, and abdomen, urinary frequency, and weakening. So for probable sign of pregnancy is enlargement of the abdomen, Chadwick's sign, Hagar's sign, Goodell's sign, Braxton Hicks constructions, and ballotment, and positive pregnancy test. So the positive sign of pregnancy is fatal heart rate, fatal heart uh, sounds present, movement, fatal movements, and fatal outline felt by examiners and fatal outline by X-ray and sonography. So the formula on how to compute AED using indirect methods is first is the Nagel's rule. So in Nagel rules, add 7 days to the first day of the last menstruation, subtract 3 months and add 1 year. So for fundal height, palpations on the interior abdomen, 8 to 10 weeks, slightly above the symphysis pubis, then 6 weeks at the level of the umbilicus, measure using centimeter tape, measure during the first and third trimester measurement correlates with gestational age, and the McDonald's rules is the measurement from the symphysis to fundus the uterus during the second and third trimester using a centimeter tape measure. So to perform the general physical examination during prenatal care is first is to explain the procedure to the client, check the vital sign, the blood pressure, the temperature and pulse rate, and also the weight and the height. For the general physical examination, infection, the client's postures, facial skill, nasal mucosa, breast, abdomen, extremities, genitalia, and rectum. So for palpation, palpate the thyroid gland, breast, abdomen, and pubis. And for escalation, oscillate the fatal heartbeat. So for other important examination, the neurologic competence, the deep tendon reflex, the patellar reflex, the Achilles tendons, and the Bakinski reflex. That's all. Thank you.